Thanks, Rachel. Hello, everyone. My name is Ben Nguyen. I'm an Assistant Secretary here in the Regulatory Engagement Branch in the Therapeutic Goods Administration. I'll just start by acknowledging the traditional owners of lands of which we're all meeting today and pay my respects to elders past, present and emerging, and certainly extend my acknowledgement to any First Nations people that have joined our webinar today as well. So this webinar is an opportunity for you to hear from our current and past members of Statutory Advisory Committees and gain a first-hand insight into the role and expectations of our committee members. We will not be discussing the application process in any real detail during the session. However, I will touch on it at the end of the webinar. We will include some frequently asked questions on our website following the webinar as well. And please note the links to various pages on our website that could be quite useful to you if you want to put in an application or find out more about the committee roles for our advisory committees. Okay, so there are 7 advisory committees that provide independent expert advice to the TGA, and it's really worth noting diversity is very important on these committees. We have members from a variety of different backgrounds and professions. They could be anything from health professionals to academics and researchers. We have pharmacists, and we have people that have experience representing consumer groups as well. And it's probably worth noting that in particular for these positions that have been advertised on this occasion, there are 2 positions for those consumer groups or from a consumer background. There are 46 vacancies that we have advertised, and they across all of the 7 advisory committees that are listed on the slide that you see before you. Okay, thanks. I've just getting help set up here. So the advice provided by our committees is a really important element to the regulatory functions of the TGA. It's worth noting that members are paid in accordance with the provisions specified in the Remuneration Tribunal Remuneration and Allowance for Office for Holders of Part-Time Public Office Determination 2022. Current daily sitting fee is $1,199 and for a chair, and for members it's $901. If you want to know anything further about the remuneration or Remuneration Tribunal determination also specifies some general provisions for travel expenses and travel allowance, which we also provide to committee members as well. So I just wanted to cover off just briefly on conflict of interest. Members are appointed to provide professional input in relation to matters coming before the committee based upon their specialist knowledge and expertise. Sometimes a conflict of interest may arise when a member's personal interests conflict with committee duties, so that the member may not be or perceived to be independent, objective or impartial in relation to those duties. For this reason, we require new members to sign a deed of undertaking in relation to confidential information and conflict of interest upon appointment to a committee. So please have a look at our website if you want to know further about the conflict of interest and those confidentiality obligations. Don't be too concerned though. During committee meetings, we often conflicts or potential conflicts arise. I dealt with during committee meetings at the time, so process is always ongoing. This is just a quick reminder of the Slido app. and your options to ask questions before I move on to the next slide, just in case you haven't done it already. So this slide here is just some little bit of information about our meetings. They can be held either in person, via WebEx, virtually. Sometimes, and more often these days, we have a hybrid mix of members that will attend in person and virtually at the same time. The table on the right of this slide indicates the number of meetings we hold each year across those various advisory committees. It can be anywhere from 3 up to 12 meetings per year, depending on the particular committee. It's probably also worth noting when committee meetings are held, they could be held from, say, about 3 hours, and in some cases could be up to 2 days, but generally speaking, they'd go for a day, maybe a day out of your time. So we might move into the reason we're here, to ask some questions of some of our members and past member. I'll just introduce them all. Okay, so I'll just introduce Professor Robin Langham, who is a former member of the Advisory Committee on Medicines. Professor Langham is now the Chief Medical Advisor to the Therapeutic Goods Administration. She is a nephrologist and clinician researcher who has spent much of her career in public hospital service. As Director of the Renal Unit at St Vincent's in Melbourne, subsequently as an academic at the Head of School of Rural Health at Monash University. As a researcher, she has worked in translational research as part of a local biotech team that was successful in the development of novel anti-inflammatory and anti-fibrotic agents. Currently, she is also chair of the Royal Children's Hospital Human Research Ethics Committee and is on the board of the Australian Medical Council. I'd also like to introduce Professor Ann Simmons, AM, who is the chair of the Advisory Committee on Medical Devices. Professor Simmons is a provost and professor of biomedical engineering at the University of New South Wales. She has previously been head of the University of New South Wales School of Manufacturing and Mechanical Engineering and Graduate School of Biomedical Engineering. Her research involves developing biomaterials, implantable medical devices, and analysis of blood flow in diseased vessels. Professor Simmons is a Fellow of the Australian Academy of Technology and Engineering, a Fellow of the Institute of Engineers Australia, and was awarded the Order of Australia for services to biomedical engineering. I'd like to introduce you to Dr. Danielle Mcmullen, who is a member of our Advisory Committee on Medicine Scheduling. Dr. Mcmullen is an experienced healthcare leader and is the immediate past president of AMA New South Wales. She has strong skills in system design, medicines regulation, advocacy, and leadership. Dr. Mcmullen has a passion for doctors' health and is a current member of the Doctors' Health Services Board. She's also a GP by day who strives to provide comprehensive patient-centred care to her patients. So I'll welcome all our panel members, and I'll now invite them to make an introductory statement each, starting with Robin.
Thanks very much, Ben, and welcome everybody, and a special welcome to Anne and Danielle for their time this evening. At risk of sounding like the man who tried the razor blade and liked it so much I bought the company, I think I can clearly demonstrate by my current role that I've really enjoyed the time that I spent working on the advisory committee on medicines for the TGA over the last few years. I am also wanting to acknowledge the traditional owners of the land that I'm on, the lands of the Wurundjeri people of the Kulin Nation, and pay my respects to their elders past, present and emerging, and also pay my respects to any other members of the First Nations people who are here. I do want to encourage anyone who has even a mild interest in working in the statutory advisory committee area. The workings of the TGA, I think, are such an important part of how the access to and use of all therapeutics is administered on a national level. And my recollections, at least, of my very first advisory committee on medicines was having to present and give some advice on one of the very, very few new nephrology drugs that were coming through the pipeline for polycystic kidney disease. And when it was decided, on the advice of myself and another nephrologist and the committee as a whole, that this was in fact a medication that should be moved forward to registration and patient access, it was a really it's a really good feeling to think that that I was contributing to the level of care that affects patients as a whole, and really moving into a much more of a whole of health field rather than just the single one-on-one patient experience that I'd had in my clinical work so far. That's my introductory statement. I bought the company. Thanks, Ben.
Thanks, Robin. I'll now invite Ann to make your introductory statement. Thank you.
Thanks, Ben. And welcome to everybody on the call this afternoon. And thank you very much for showing interest in these committee appointments. I'm the chair of the Advisory Committee on Medical Devices, as Ben said, and we provide advice to the TGA on all medical devices, and that's from anything from masks through to cutting-edge interventional cardiology devices. So I've been the chair of that committee now for about 5 years, and my committee comprises medical specialists from all different sort of specialties. We've got orthopaedic surgeons there, cardiac surgeons, we've got cardiologists, nephrologists, ophthalmologists, but we also have biomedical engineers on the committee, we have human factors specialists, and of course we've got our wonderful consumer reps. So it's a broad church because we provide very broad advice to the TGA. And what we also do across all of the committees is sometimes we just can't provide the specialist advice that the TGA wants or needs. So we bring in specialists when particular devices require that specialist information. But the committee itself provides the advice in the long run. We don't make decisions. None of these committees make decisions on behalf of the TGA. We provide specialist advice, and that's really, really important to understand as well. I thought to myself, why do I do it? And sometimes when I'm in the fog trying to fly into Canberra on a really cold winter's morning, I do think to myself, why do I do it? But I thought I really identify strongly with the remit of the TGA. The TGA, I don't think the average person in the street knew what the TGA did until 2 years ago, and now they sure as hell know what the TGA does. But the TGA regulates medical devices, it regulates medicines, it regulates vaccines, biologicals, all of these therapeutics, with the aim of keeping Australians safe and healthy. And I really identify with that. The other reason I do it is because I've made some really amazing friendships on the committees that I've sat on, not only the ACMD, but I've often sat in on ACM meetings and other meetings across TGA. Really, really wonderful friendships with the people I've worked with, both in the TGA and on the committees. But also it's an amazing web of contacts for you going forward. If there's ever an issue you've got that's a medical issue or a device issue or a medicines issue, there's always someone you can contact. So I would very, very strongly encourage you to think about doing this, and I'm happy to answer some questions after Danielle.
Thank you, Ann. Appreciate that. Danielle, I might hand over to you for your statement.
Thank you. And I'd also like to acknowledge the traditional owners of the land I join you from, which is the Ngunnawal people today. I've snuck into Canberra temporarily. And impressive to see so many people online. I think we're about 200 of you watching, which is just incredible amounts of interest. I sit, as Ben mentioned, on the Advisory Committee for Medicine Scheduling, and I'll talk a bit more about what we do in a minute. But I too have really enjoyed my time with the TGA and the ACMS. I've drunk the Kool-Aid like our other two speakers have, and really keen to share that with you all and to encourage you to be involved. A couple of practical type things. It really was a steep learning curve at the start around medicine scheduling, and so I don't want people to feel put off if you've not had specific expertise in the area, because there is a really supportive group and no question of mine was ever seen as too silly. You certainly don't need to be an expert necessarily in the detail of the committee you join, because there is a mix of people on each committee, but there are obviously some skills to bring along. I got involved in the ACMS after being sort of on another committee that the TGA had arranged around opiate reforms, and kind of found it really fascinating. And so then when the vacancy came up on medicine scheduling, thought I might have some input to add there. And like Robin said, really, it's, as a clinician, I find it really rewarding to be able to make a difference to patient care outside of my clinic role, and to use my brain in that different way, trying to understand the world of medicine scheduling and the regulatory framework around medicine's use in Australia. In terms of skills, I think that you need, I think, probably is around processing complex information quickly, and I think we'll cover a bit more of that in the question section. But a bit about what ACMS does. As I mentioned, we cover really broad issues. Usually it's medicines or substances where the sponsor or another group has asked to consider rescheduling. So whether that's upscheduling or downscheduling something from prescription only to pharmacy medicine, for example. Things like the rescheduling of codeine would have come through ACMS. We talk about everything from the oral contraceptive pill to triptans to substances in cosmetic creams and cannabinoids. So it really is a varied discussion, and each item is assessed on its risk profile and against the scheduling framework, and that balance of expertise on the committee helps us have some interesting discussions and provide advice back to the TGA about what decisions they might want to make. Really, the highlight for me has been support from the Secretariat. I sit on a lot of committees in a variety of organisations, and would say that the TGA has some of the best meeting papers, that you never feel unsupported. You do get high quality information in a timely manner before the meeting. It does take a bit of time, but it is well supported, and everyone on the committee tends to be well prepared, which is good. So you always know that it's going to be a useful use of time. And happy to answer some more questions maybe if people have questions about how it works in the meetings, because I know I didn't really understand what actually happens at these meetings and how much work you have to do before, but I'm happy to go through a bit of that if you wanted to, Ben.
Well, thanks, Danielle. That's a perfect segue into what is the first question, and probably the most popular question so far. So just noting that we received some questions from people during registration, but they're also coming in now and being voted upon. So I'll go to the first one. And I might ask this of all of you because you're on different committees and there might be some differences. What is the time commitment, including preparation before a meeting? And perhaps I could maybe go in the same order on this occasion. Start with you, Robin.
Thanks, Ben. I guess it really depends on, and for the Advisory Committee of Medicines, these are obviously medications, drugs that have been through an evaluation procedure by skilled evaluators within the TGA. And there's often, as is often the case, there's an element of real world or day-to-day practical clinical experience and advice that's required. So to a certain extent, the Advisory Committee on Medicines, though it is diverse, does have a group of specialists in particular medical areas, as well as some general practitioners, as well as those that are specialists in clinical pharmacology and our very important consumer groups, that for each of the medications that come through for advice, and that can number anywhere between 5 applications over the course of a day, or as has been the case, especially during the last couple of years, anywhere up to 10 or 12 applications over a period of 2 days. So for me, as the nephrologist, it really depended on whether there was anything specific to do with nephrology that I was asked to be the prime spokesperson on. So that, taking something like that and working that into a presentation and answering the questions that were posed in a very sort of thoughtful, scientific and robust way, and also being able to bring the rest of the committee along with you in terms of how you processed that information and arrived at the decisions that you did, that sort of pre-meeting work would take probably anything up from 2 to 3 hours, not all in one block, obviously, for each meeting, depending on how many medications I was being asked to speak to. But as well, for all of the other medications that were being brought forward, a read of the really well curated sort of issues for discussion part, and considering each of the questions, I think was the main problem. Being the nephrologist also, there was often renal excretion and renal tolerance questions that were sort of filtered throughout all of the other ones. So I suppose for me, in answer to that question, again, depending on whether there were specific medications that the nephrologist was asked to attend to, it would be probably 2 hours plus another hour or so of reading through the rest of the papers. So not an onerous thing. And I might add, one thing I did forget to say right in my opening statements, I found that this was, for me, the best journal club in the world. The amount of learning that I did at every single meeting was just next level. And I do remember being able to come home and talk to my husband, who's also a medic, to say, did you know they've actually got a drug to cure cystic fibrosis? And so it was, for me, a fantastic way to keep up my learning and really to help keep abreast and understand just what was going on in the pointy end of drug registration in Australia.
Just following on from that, Ben, if I'll keep going. I think Robin described well then how these meetings work. So ACMD is during a day. We take a day for our meetings and we go through about 6 to 8 devices in that day. We do pre-market assessment and post-market assessment for devices. And what happens is there's a list of 6 to 8 devices and one committee member is the lead per device. So that person has to read the significant documentation on each device, on that particular device, and present to the group some background about that device, and then how it's used, how it's clinically used, what the issues are, and then articulate the questions that the TGA wants answered. And then they go through their logical responses to those questions, and then it's opened up to discussion in the group. So if you are asked to be the presenter of one of those, on one of the devices or one of the medicines or one of the vaccines during the day, it will take you 2 to 3 hours to put that presentation together, because it's like teaching someone starting from scratch what the device is, what the situation is regulatory around the world, what this particular question is, and what I think the answers are. So that's one situation. If you're not being asked to present a particular device or medicine at that meeting, I think I agree. It's probably about 2 or 3 hours just to read through the 8 devices or medicines that are in discussion at that meeting. So that's giving you a little bit of an idea. As chair, I do more, but that would be the general membership. Danielle?
Yeah, ACMS runs quite similarly. So we usually have a whole day. It varies. So 3 or 4 times a year, I think they put down that it's usually a whole day meeting for the ACMS. But what we also have is a joint meeting with the ACCS, which is the Advisory Committee for, geez, now that's bad, isn't it? the C, not medicines.
Chemicals.
Chemicals.
Chemical scheduling.
Chemicals. That's
Chemical
it. I should know. See, you can tell I'm not on that one. But chemical scheduling, but there's a joint meeting of the two, because sometimes, particularly for chemicals that are in skincare products, for example, are often an item that might be on a joint committee meeting. So usually the ACCS meetings are all up. It's a day and a half. Sometimes it's all on the one day, and sometimes rarely it's the 2 full days. But that's for the meeting itself. Similar process, there'll be sort of 6-ish items often on the meeting agenda, and ahead of the meeting you get a list of the items and get to put in preferences as to what you might want to present or things you can't present on because of a conflict, and they try and allocate them based on that. Depending on how challenging the item is, your presentation, there's 2 people that present on each one, a primary speaker and a secondary speaker, who sometimes agree and sometimes don't. So that can be interesting in terms of whether the medicine should be rescheduled. But depending on how complicated the item is, I find that to present, I spend somewhere, maybe a good one would be 2 hours, but often there is quite a lot of reading. Sometimes some of the items are quite complex and, can run up to about 1,000 pages of pre-reading. That's not usual, but lately we have had a few. So that can take quite a few hours to get through and to do the presentation. But then similarly, you get quite good summary notes, and usually in terms of reading over the other items that you're not presenting on, I must admit I usually do that on the flight down or the night before, have a skim through the other items and just get them so they're fresh in my mind for the meeting the next day, and ready to have some thoughts prepared for that discussion.
Thanks, Danielle. All right, I'll move to the next question. I might ask this one of you, Anne, initially, and maybe the other panelists might want to elaborate. Particularly in your role as current chair, what level of specialist expertise is needed? And you did touch on this a little bit before. And what is the balance of specialist input versus general input expected of members on the committees?
Yeah, it's a really, really good question, Ben, because in medical devices, we're all over the shop in terms of specialties. So we've got, as I said before, we've got a lot of orthopedic devices come through. So we usually have 1 or 2 orthopedic surgeons on the group. We've got the cardiologists, the cardiac surgeons. We have got a nephrologist and ophthalmologist. So there are probably 1, maximum 2 specialists in the area of a particular medical device. We have anaesthetists as well. And then everybody else is there as an experienced advisor and discussant. So, and as I said before, we also bring in external expertise if we don't feel that we've got it on the committee as well. So you can't be an expert in everything in medical devices or in any of these areas. So we do have specific experts, and if you're not that specific expert on that particular device, you might be for the next one, and the rest of everybody is there to help the TGA with advice. Robin or Danielle?
Yeah, I just wondered if Robin has a perspective, particularly because you've been on the medicines committee and in your current role in the TGA, and you're also currently on the scheduling committees at the moment. So we appreciate your view.
Oh, absolutely. The level of so I found that I slotted into this role quite easily because of my research background and being able to understand the ins and outs of clinical trials, which is more the science and the evidence of what's being presented. But I don't think that's necessarily a requirement, because understanding there are a lot of experienced evaluators within the TGA, medics and so forth, who are able to take that clinical trial information and digest it and present it to you. There is, I think, definitely a need in medicines for different subspecialties in terms of nephrologist, cardiologist, clinical pharmacologist, et cetera, Like Ann's committee, though, if there was just one nephrologist in the room, we would always be looking for an external advisor to help as the second a voice in order to gain a little bit of a diversity. I mean, Danielle's mentioned that there is disagreement, and while we never come to blows, it can make for sort of lively discussions, and then it reverts back to the skills of people like Anne, who are the chair, in order to negotiate an agreed statement on something. So you're never the only specialist that's speaking on an area, and you might actually be a generalist. In that there may well be medications that are coming through that are being considered for rescheduling or restrictions put around their prescribing. So there's a lot of external advisors external to the committee that are still coming through. And I think it's important to, I think if you're uncertain, put your hand up. And the TGA will certainly let you know if there's an opening for someone with your expertise, rather than thinking, oh, look, I'll be great on ACM because I know everything there is to know about medications. And you might actually find that it's Danielle's committee where we're looking more for advice on how this drug sits within the community in terms of access to it from either a pharmacy level or a prescription level or a please don't ever touch this drug in your life level. So I wouldn't necessarily hold back in terms of imagining for a second that you didn't have either the right level of specialisation or the right level of expertise and skills in being able to read complex dossiers. I'm not meant to use that word dossier, am I, Ben? No. Applications, there we go.
Thanks, Robin. And it's probably worth mentioning that sometimes those external advisors that are brought in that aren't members of the committee might do a lot of the preparatory work
Exactly.
and present to the committees because of their specialist knowledge. So it's an important function as well of the committees. I might move to the next question and ask this of you, Danielle. And it's ask about what skills should a member have other than in their specialist discipline.
Yeah, I think as I sort of touched on before, I think the most important skill that I can think about for this is being able to quite quickly process complex new information and still be able to come up with a common sense response and useful feedback for the TGA. The substances that we review in my committee are so diverse that you're never going to know. I would be surprised if anyone knew all about all of them. So it's often that you're coming across a substance that you can't even pronounce, let alone understand it before the meeting. But quite quickly you can we do have really good quality papers and good advice into that, and the speakers will have done a deeper dive, think about it. But still the expectation as a committee member is that you can listen to that presentation, you can have a quick flick through the papers, you can use if you're a clinician, use that clinical expertise about the application, the real life impacts of the decision that's being asked of you or the advice that's being asked of you, and to give that feedback quite quickly. So it is a lot of thinking on your feet and obviously concise answers. I've not done a very good job just now, but giving concise feedback in the meeting to help it move forward and help the group reach consensus on what can be some challenging items from time to time.
Thank you.
And Ben, just one thing I'd like to add to that. There's a sense of you need to be game to ask the questions too. We want people to ask questions, and you need to, well, not fearless, but we need people to be, really question everything that's being put in front of them. So I think a very questioning mind, I totally agree with Danielle, you've got to be quick on your feet, you've got to pick up information. But the committee members that I really listen to a lot are the ones that ask the hard questions.
Mm. And that's a lovely segue into what it is the consumer members can offer the committee, because more often than not, you've got a couple of, very serious medical brains sitting around looking with a very sort of myopic lens at something, and the consumer will actually come up with the practical question and the real question of just how are, for example, people who live in rural areas meant to access this drug with these sorts of restrictions around them. And Yeah, so don't think for a second because you don't have the right specialty for that particular question that there's not a level of contribution that needs to be put in right across the board for all the different items up for discussion.
And from my experience, it's a really safe space to have those discussions. I've found ACMS to be a really excellent committee from that. There's such someone else mentioned, go in person from time to time if you can, because it's just a fantastic group of people and different group than we get together with often. And there is robust discussion, but it's respectful and yeah, a safe place to have those talks. And then the TGA does listen, and so it's helpful to know you're having that impact.
I agree, Danielle, and it's been a sad couple of years where we've not been able to gather in person, but having had a couple of years where the in-person opportunities to meet and discuss and create that level of network and even friendships, I think is now starting to come back in and super add to the value that these committees give back.
Robin, you mentioned consumers. I might ask this of you all if you've got a perspective, but there's a question here about consumer representatives and what other members expect of them.
What other members of the committee expect?
Yes, what do members expect of consumer representatives?
I think what the committee expects of consumer representatives is to have exactly that. And at least in medicines, there's very much an element of, let's talk about drug safety, let's talk about how the drug should be prescribed, let's talk about whether the drug should be out there in the community and just prescribed by whom. But as well, there's an element in each medication that's on the register of the consumer information. And I think it's very important that element of every application, and it is, you know, for some of the consumers, that's really what we're asking of them is to have a look at the sort of consumer information that goes with drugs that are coming out into the community and to let us know if what it is we are talking about in a very technical sense is translating through to the consumer need. It's such an important part of the committee that, and it's almost a bit of a reminder of why it is we're there, because we are here in order to make sure that the right medications are getting to the right people and in the right way.
And just following on from that, I've been really lucky in having some fabulous consumer reps on ACMD over the years. And I always ask them every single item right at the end, if they haven't said anything already, what do you think? And sometimes, I can't remember whether it was Danielle or Robin, sometimes there's been this massively medical discussion about this and that and this and that, and the answer's no, no, no. And the consumer rep will say, and if this is not available, will there be anybody who suffers? And that brings it all home to everybody. Just the frank and fearless questions that the consumer reps ask are just incredibly important to every committee, I think.
I agree. They often bring us back to earth, and it's sort of, there's another question that has popped up around, you know, scientific professionals or just clinicians and consumer reps. And I think you know, Ann's from an engineering background, and the ACCS has scientific brains on it, and the ACMS, you know, there's a bit of crossover there, so it's certainly not all doctors in there just talking about these things. It's a diverse group of people, and that sometimes adds another consumer lens in a way, another non-medical brain. But the consumer focused people really are helpful to bring us back to earth around, okay, what does this mean for people trying to access these products? And a good reminder then from Robin that we also do make comment on things like packaging and labeling and all of that too. It's quite interesting content.
Thank you. Just wondering if there's a question here that maybe it's for me to answer, but will there always remain the flexibility to attend meetings virtually, given people are interstate? And I believe the answer to that is yes. However, it is encouraged, you know, certainly for people to come and attend those meetings in person if possible. There is some advantages, as the panel have pointed out, to doing that. So, but that flexibility is there, absolutely. And then there's another one that's at the top list here around whether you're allowed to apply for multiple committees. And I do wonder if the panelists have done that in the past. There was at some time you've applied. And the answer is yes. You'll see during the application process, you can select multiple committees that might fit your interest or expertise as well. So I just wonder about this one, whether, and I'll invite you all or any of you to answer this one. Once appointed to a committee, is the expectation that you would attend every meeting for that committee? Noting, for example, the committees with 12 meetings, that's quite a workload, but potentially. What's your experience there?
I might take that one first, Ben. The ACM, of course, 12 meetings a year. Occasionally, it's just the case that busy clinicians and other things are in place and people can't attend, and that's certainly understood. If you're not able to attend and there's a specific item that your advice is requested on, you can also always send notes. You can send, PowerPoint slides. You can dial in for a brief period where your advice is being sought. So that flexibility is certainly there if you're not able to come to every meeting. Yeah.
And just to add to that, there's flexibility within the day as well. So if you're available at a particular time, I don't think I've ever run a meeting where the items have gone sequentially from 1 to 5. They're all over the shop because the ophthalmologist is only available at 1 o'clock. The renal physician's only available at 4 o'clock. So we mix all the items around to fit busy schedules. But having said that, we also put the dates and times in our diaries at least a year ahead. We don't muck around with the dates once they're in there. We sit there in October each year and do the 6 or 12 dates for the next year, trying to get everybody to put aside those times, because it is important to come as much as people can, because there's a blend of information that comes out of a full group that you don't get with a partial group. But there is certainly flexibility there.
Yeah, we've got a very well-behaved committee that tends to do it, but it could be that we've just got lots of state and territory reps. So a lot of ACMS, the expertise is, so the medicine, the deep dive into the scheduling expertise comes often from our state and territory reps that do that as their job. And so then the members are appointed more for the real life expertise. There's only a few of us. So it's helpful if everyone's there because it's a small committee and it only meets 3 or 4 times a year. So most people can make that happen.
Perhaps it's a measure of the attractiveness of the ACM committee that even when we've had additional meetings set up, and this has been especially so in the last couple of years with COVID therapies coming through at pace, that the need to be really agile and turn up at a couple of weeks' notice. That's really well attended and always an opportunity for lively discussion. And again, like I said, you learn so much in this process.
Thank you. And just the other part of that question about how far in advance we know about each meeting, it would be about 12 months in advance. There's a fairly forward schedule, so which would help. And then the next question, how many years is an appointment to one of the committees? It's generally speaking, it's up to 3 years. It can be shorter, but it can go for, and sometimes committee members will extract themselves early for personal reasons, and that can happen too. Then the following question, I do wonder, there's this question here around about the application process and asking how long a cover letter should be and etc. And I just wondered if maybe each of you, from your own personal perspectives, might have some advice on those that might apply and how they might pitch it or how they could potentially apply for one of these committees and what you think would be important, given that you've applied before.
I have an N=1 experience, Ben, and that is 1 page. Short and sweet, and give them the detail that they need. I don't know.
Mine was similar.
What did you say, Danielle?
think mine was similar. My N=1 trial of a short application. You might have been short of people when I applied. I don't know. There seems to be some competition this year, but coming along tonight helps. I think showing that you've got an understanding of who the TGA are, what the role of these committees is, as Anne said, that it's providing advice. You're not making decisions, and what expertise and skills you think you bring to that group, but keeping it short.
Yeah, and 1 page from me as well. And then you have to put in your CV as well. I think a shorter CV is better as well. I don't think they want to see 60 pages of publications. So a short, concise CV that demonstrates what you can bring to a particular committee is really important.
Thank you. You know, in previous years, we can get almost 200 odd applications. So yeah, sometimes short and to the point is quite useful. There's a question here about travel and accommodation costs. I did cover this briefly. Yes, travel related costs are covered if you decide to travel to Canberra. And there's one here around the Medical Devices Committee. Do you need to be a medical specialist or a practicing engineer to be suitable for the Medical Devices Committee? What about a specialist in the Australian consumer law and product safety?
Look, I think that we're open to all sorts of backgrounds for medical devices. We've got a human factors specialist there. We've had biocompatibility specialists before. We've had scientists. It doesn't have to be a medical specialty. I'm not sure about consumer law. I'd let the TGA probably respond to that one. Product safety, absolutely, because we're all about safe and efficacious devices. But I don't think your background should hold you back. Just be very clear about what your background is, and the TGA will assess whether it's useful. And I think someone said it before, don't particularly think you know which committee you're most appropriate for, because sometimes the TGA will see in your CV something that you may not see yourself. So, you know, make it broad. Not sure about law. Ben, you might like to explain that one.
It's probably worth mentioning people will have personal circumstances they want to inquire about. So I'd suggest write to the committee vacancies email address if you've got specific questions about your experience or your circumstances. We can sort of reply and try and handle your questions that way, given your particular backgrounds that people have. There's a question here around the next round of recruitment if they're unable to do this one. We generally do it every year, but it's a 2-year break. So the next round will be in 2 years. So if you're keen, probably a good idea to apply now, I suggest. I might just go down to a question that sort of I thought was interesting, and it might be just time for one more anyway. Do all members of the committees work as a team or individually? And I'm happy to go to any of you first. Maybe Danielle, if your view.
I think the way the ACMS tends to work is that people usually do their presentations alone, that pre-meeting preparation, and often that's quite helpful because, as I said, sometimes you don't necessarily agree with the other person. It's quite interesting to see how two different people from different backgrounds approach the same substance. Having said that, from time to time, on a kind of controversial medicine or something that's been a bit more challenging, there has been a bit of discussion before the meeting between the two presenters just to kind of get our heads around it and nut it out together a little bit. But of course, coming to our own recommendations to the group, and then the group considers each medicine individually as a group, and there's discussion. Sometimes that's easy and everyone agrees and it sails through and it's a quick meeting, and other times there's discussion around it, and as much as possible you try and reach consensus advice from the committee back to the TGA. But if there is a bit of disagreement or differing views amongst the committee, that's noted, and the TGA, the secretary, can take that on board and recognise, when making their decision, that it was a difficult discussion for the committee.
Thanks, Danny. Robin, Ann, do you have anything to add?
Not
I
really.
think Danielle's covered it.
Similar for our committee as well. Thanks, Danielle.
Might just end it there, the questions to the panel, because I just wanted to cover off on the application process as best I can. There's a range of questions here, very quick ones. Yes, pharmacists. There are some pharmacists on a couple of the committees. There's 2 vacancies for consumer representatives this time around, and committees. You might not quite sure which committees. I can't answer that one at the moment, so you might want to write to us. So I'll just go back to the slides. All right, so my apologies for the delay. So applications will close on the 4th of September at 11:30 p.m. They've been open for 4 weeks, so yeah, do get your application in and work on it if you're interested. And basically, you can apply. You basically apply through our Department of Health and Aged Care recruitment portal. There'll be links to that through the website. Generally, what you'll be required to do is there'll be a cover letter. You'll put your preferences down for the various committees that you're interested in. Your current CV, short biography as well, and a fully completed and signed declaration of interest, just to cover off on the conflict of interest side of things. Contact details for 2 referees as well. Regarding the assessment process, specific fields of expertise are relevant to the committees. So we are trying to find a diverse range of members. So there might be members in certain fields that we might need to fill on committees at any one time from year to year. Geographical diversity is an issue. Cultural and linguistic diversity as well is something we'll look at. And gender diversity, of course, as well on the committees. The minister ultimately selects the members of the committees. We don't do interviews, but there may be you might find that might be a follow-up call just to kind of clarify points on an application or to find out more information. That does happen from time to time. And any new member will be appointed with their term of appointment commencing on the 1st of January 2023. Once you're appointed, there are induction sessions that will be conducted in January and February next year. And of course, if any applicants that are unsuccessful, you will be notified about the recruitment process as well. So that's probably it just from the application process. I'd really like to thank the panelists, Robin and Danielle. I really appreciate your really interesting insights and really look forward to working with you as well on an ongoing basis in the committees. Thank you, everyone, for your time. As I mentioned, if you have any further questions, you can contact us on the committees.vacancies@health.gov.au. email, or do check out the website as well. Please note that we will have a new website shortly. So from Tuesday evening next week, the website will look different. So don't get confused, and you'll be able to hopefully find what you need on there following Tuesday evening. Thank you very much, and good evening.